Greetings and salutations. My name is Dr. Hartwig. I'm a doctor of physical therapy and owner of Atlas Health and Wellness with my lovely wife, Anna. We opened Atlas Health and Wellness to empower individuals to shoulder the weight of their world in any way possible, whether you're a construction worker, a stay-at-home mom, professional athlete, it doesn't matter. We're here to empower you. Earlier today or this week, I will have released a video on hip abduction deficits and the prevention of patellofemoral pain syndrome. Today, we're going to be discussing hip strength deficits in people with symptomatic knee osteoarthritis. Did I mention I'm dyslexic and have trouble writing and reading? Anyway, a systematic review with meta-analysis. Alrighty. So what they do in a systematic review is they review published research papers. And this is usually helpful in deducing whether or not something is beneficial for patients. I'll briefly cover the background. A complete understanding of impairments associated with knee osteoarthritis would optimize exercise intervention for people with knee osteoarthritis. Our current understanding of hip strength deficits in the population is based on studies with conflicting findings and small samples. There is a need to systematically review the pool of current evidence. Agreed. If you watched my video earlier this week, you will have seen that there was a net positive effect of individuals, women specifically, strength training their external rotators and hip abductors in terms of improving quality of life, reduction in symptoms of patellofemoral pain syndrome. And there is the difficulty with physical therapy and how we do research is that arthritis or osteoarthritis is a progressive disease, right? So time and measuring an individual over the amount of time that is necessary longitudinally to measure these things is extremely difficult to keep track of these individual cohorts over time and individual instances in which they are injured, circumstances. It's a mess because arthritis is a progressive disease. And as you will see in the discussion, they mention this, that there is little evidence suggesting that hip abduction strength is correlated with reducing the risk of osteoarthritis of the knee. I'm going to go out and take a educated guess. And this is the problem with institutionalized research. They're not willing to focus on prevention. They go where the money is, where NIH is paying, et cetera. And so when they look at practitioners that are in the field, seeing the interventions implemented and the results, as well as individuals that develop osteoarthritis, what are the common findings in these individuals? The bottom line is that they have difficulty putting the two together, which is very unfortunate for the population because sometimes there is certain risks that need to be taken in order to move forward in science. So osteoarthritis poses a significant personal and global economic burden, no doubt. The pathogenesis of osteoarthritis is characterized by the destruction of cartilage and subchondral bone and by synovial inflammation. And I would argue the patellofemoral pain syndrome is the predecessor to knee osteoarthritis. It is a gradual process. It does not happen overnight, and that is why we have so much difficulty measuring people over time. I think in time that we may be able to measure these things if we get enough funding to be paid to monitor people from birth to death, but that's very difficult to do. So in this study, they took a bunch of studies. I think it was 2,726 studies. They eliminated duplicates. They screened by title and abstract. They got down to full text assessments for eligibility. There was 102. The eligible studies was an N of 5, and the hip strength in knee osteoarthritis compared to controls, there was only 5. There were no studies on hip strength as a risk factor for knee osteoarthritis development. As I mentioned before, this is something that is wrong with our profession in terms of whether it's funding or just approach, how we could possibly measure someone at the age of 18 through their entire life and to see their strength over time, who's going to be at risk and who develops the arthritis, who doesn't, because it's so individual. You could be in a car accident, hit your knee, that could cause knee arthritis. But here's my thing. Despite there not being a research study that does this, that does not mean that there isn't evidence that suggests this. As earlier, I produced a research paper showing that there was a significant improvement in quality of life, symptom reduction in female athletes that participated in abduction strength training and external rotation strength training. So if there is a presence of an inflammatory process and this process is impacted positively, meaning the inflammation goes down, their quality of life goes up, there is suggestive evidence that specific strength training of the abductors and external rotators will help lower the risk of developing osteoarthritis. Now that's a jump. That's it would be crazy for me to make such assumptions. But guess what? I'm a scientist. I'm a rebel. I'm not trying to appease the institutions because they are, I'm going to say it, rotten to the core. And funding is not, they don't care about preventative care. There is so much money tied up in the American Medical Association and other groups of medical providers that would, they need those knee replacements. They need those surgeries to keep, the car payments paid for. And I need patients to invest in Atlas Health and Wellness to help them not need those things and get ahead of the game. And so we focus here on prevention. If you're curious about what we are doing, you go ahead and make an appointment, 954-932-8527. Again, I'm in Powerhouse Gyms in Stuart, Florida. If you're not here, obviously you can't come, but if you got questions, hit us up on info@atlashealthandwellness.com. All right. So they took these 5 studies and broke them down into different categories. And I'm not going to go into the exact detail because the meta-analysis is pretty mind-bogglingly confusing, and I'm not going to bore you with that. But what I will talk to you about, let's see, is the conclusion. People with symptomatic knee osteoarthritis present with hip strength deficits. I'm not shocked at all. Wow, that's groundbreaking. Again, the study I just talked about earlier today or earlier this week was about how the reduction or improving females' hip abduction strength and external rotation strength lowers inflammatory processes such as patellofemoral pain syndrome, which is, in my opinion, the predecessor to knee osteoarthritis, with the exception of acute trauma, like hitting your knee on a dashboard or falling down a flight of stairs and landing on your knees. Okay, we can't always prevent that kind of trauma, but micro trauma, the trauma from everyday use, Atlas Health and Wellness, we believe that if you apply the evidence in preventative medicine or preventative rehabilitation or restorative medicine, whatever you want to call it, we can literally stop the hands of time to a degree. Again, acute trauma like falling and things like that aside. What else did they say? They said there is moderate quality evidence that people with knee osteoarthritis have significantly weaker isometric or isokinetic hip abduction or abductor strength compared to healthy controls. Further work is needed to support the current findings on hip adductor strength, as well as sagittal and transverse plane hip strength. Agreed. So what the sagittal plane motion especially, in that your hamstrings are super duper important in controlling anterior tibial translation. That's not mentioned in this article. And that is, again, one of the downfalls of how we're approaching physical therapy and research. We're so caught up in just keeping so many variables in this little box that we've, missed the forest for the trees or the trees for the forest. But anyway, I digress. Prospective studies are required to determine whether hip strength is a risk factor for development of knee arthritis. However, in the meantime, it is recommended that the baseline hip strength assessment be incorporated into common clinical practice in those diagnosed with knee arthritis. So what they're saying is basically, if you have someone that has knee arthritis, you should probably incorporate strength training of the hip abductors when you're working with them to help slow the process or reduce the inflammation of the knee. Again, the thing I just published earlier, or the thing that I just put online earlier today, talked about how improving female athletes with patellofemoral pain syndrome significantly reduce or improve their quality of life, reduce their inflammatory symptoms over 6 months. And I would argue that the aggressiveness in which they train these individuals could have been much better. But that's my personal opinion, and you know what opinions are like. Everybody has one. Again, my name is Dr. David Hartwig. If you have questions, reach out to us at info@atlashealthandwellness.com. Or if you want to schedule your free evaluation with us, 954-932-8527. This is Dr. Hartwig signing out. I wish you all well. If I can figure out how to turn this off.